My name is Tina Santee, and I have hereditary angioedema.
My mother's initial diagnosis was myelodysplasia, type of leukemia. My husband and my son and I were living in New Jersey at the time. Another World was still on the air, so I was working back east, and my mom and dad were in California. And I remember exactly, I was standing in like the little entryway of our house and kind of collapsing on the stairs, and I guess the way I called my husband's name, he came running because he knew something was wrong.
When we heard the diagnosis, I mean, we were immediately devastated because that was actually the one diagnosis that I did not want to hear. Any of the other ones I felt like had a good treatment, things like that, an easier way of life after the diagnosis. Hearing Pompe disease, it was just very devastating because we weren't sure if she would make it to be 1 or 2 years old.
Yeah, it was a bittersweet moment. We finally found something that could perhaps help us manage day to day instead of just getting that type of treatment in the hospital. But the cost was unbelievable. I mean, within a month and a half, most people hit their annual salaries just in that medication alone. So having to get the approval from the insurance was quite a headache. They wanted us to jump through hoops to get it approved, and then even with the approval, all of us with it still have to come out a considerable amount of out-of-pocket costs to even take care of the co-pays associated with it. For me, I was not going to be able to do that by myself.
Well, my brothers and I tried to figure out if we could, all pile in, and my brothers with their children, we all, didn't have that kind of resource for $5,000 a month, not even the three of us together sharing that. So she went to several foundations, and it was through PSI that she was able to afford that kind of medication.
There was something that I realized I could do and with a family. And I kind of evaluated what was going on in that family's life. And what was going on in that family's life, I thought, well, there are two things that could save this family from becoming financially devastated or in the situation that they're presently in. One was to help them afford their health insurance. Number two was to help them afford their treatment. And it was with that idea or that acknowledgement of those issues that I came up with the idea of PSI.
You make too much money to receive assistance, or you don't make enough, you can't afford to pay for what you need to pay for. So it's kind of a crazy fine line in the middle you have to find, and sometimes you can't get there, and that's how PSI helps also.
PSI helps people by being a safety net with those expensive costs and gets them through a period so that they can stay financially stable and land on their feet rather than become financially devastated.
Life without PSI would mean no life for me. Without PSI assistance, I would not have been able to continue my medical treatment. I would not have been able to have a very important surgery that allowed me to have more function of my vocal cords. So I must say that without PSI, I wouldn't be able to sit here today to thank PSI for all the help that they have given me.
Life without PSI would be probably very emotionally stressful, financially stressful, because the way they help us just takes a lot of burden off of us, and I would be very stressed out and trying to figure out what I'd be able to do on my own. Some of the day-to-day things we wouldn't be able to do, even things like paying our bills and having money to Christmas shop. I wouldn't be able to afford anything for Christmas if I didn't have a little extra here or there. But even paying for the house payment, to me, that's of course one of the biggest ones.
The demand is outweighing the supply. Just imagine if we could help all the people that come to us and the difference that we can make in their lives. I think that is really the important thing here.
We cannot survive unless we have the financial donations of those who provide support for PSI. We can only assist those we support in direct proportion to the funding we have. But beyond that, I think there are many donors we work with, whether they're pharmaceutical donors or state donors or other donors, who have a real understanding of the plight of these patients.
To help PSI means that you're helping people who are not really known to the public. We all have rare diseases. A lot of people have never heard of the diseases. So to get funding and to get help is really hard for us. So to have an organization like PSI who looks out for this small dog and help us out, it really makes a big difference to our family. It is a full help that they're able to give, from support for your doctors to helping you navigate to the next step with disability if you have to go that route. So I believe that helping PSI, you're also helping your neighbor, the person down the street that typically you wouldn't know that they're suffering from something because it is so rare.
Thank you so much. Thank you for all your help, not only for my mother, but for the 12,000 and counting that you are helping and guiding, and we really treasure you, your hearts, your efforts. Thank you.